Now come towards the side effects. These are the side effects are also which are marked in the red one. These are actually the specific for these carbamazepine causing aplastic anemia, causing SIADS, syndrome of inappropriate antidiuretic hormone. Why causing aplastic anemia? Because it suppresses the bone marrow. So the bone marrow won't form any blood cells. It leads to the pancytopenia. Why it's causing the SIADH? Carbamazepine does what? It triggers the posterior pituitary to release more and more ADH. ADH does what? It is antidiuretic hormone. It increases the water reabsorption. Okay, and it will lead to what? Dilutional hyponatremia. Sodium valproate does having many other side effects I mentioned here. I'm going to tell you detail about this in a few minutes. But these are the side effects which are specific for the sodium valproate. Like sodium valproate, this is a pancreas pick. The sodium valproate irritate the pancreas and cause pancreatitis. These are the platelets. A bad picture, but try just. Sodium valproate does what? It decreases the thrombopoietin production, so decrease platelets, thrombocytopenia. It irritates, it damages the liver cells and causing the hepatotoxicity. Okay, and lamotrigine I just mentioned that it is causing the SJS, Steven-Johnson syndrome. It is one of the immune reaction causing rashes on the skin and other skin conditions. Why I wrote there SJS and try. Try 3 and SJS, 3 words. Steven-Johnson syndrome. So learn in a way, in easy way. Okay, try and SJS. Side effects of there are also the GABA agonist drugs, and in GABA agonist drugs there are 3 main: benzodiazepines, phenobarbital, and the propofol. And these drugs are specially given in the status epilepticus patient. Actually, status epilepticus patient is one of the condition of epilepsy which is a life-threatening. I'm not going in detail of this, but in that condition, the GABA agonist drugs are given. GABA agonist drugs, now coming towards the side effects, the GABA agonist drugs and the valproate, they suppress the reticular formation. Actually, reticular formation is that one which awares us, which maintains our consciousness. So it suppresses, these drugs suppresses them and causes sedation. Actually, all antiepileptic drugs, if you increase the dose of any antiepileptic, it will cause more and more sedation. Okay, but these are specific ones, so that's why I mentioned here. GABA agonists can also depress the respiratory center in the brain and can cause the respiratory depression. Okay, drug interactions. Drug interactions, actually, why these drugs are doing the drug interaction, these are the drugs which doing the drug interaction. Carbamazepine, phenytoin, valproate, in a different way. So that's why I classified into two. Some are doing inducing the cytochrome P450 system, and some are inhibiting the cytochrome P450 system. Okay, and when they do so, they are actually get metabolizing in the liver, and during their metabolism they actually damage the liver cells and causing the hepatotoxicity. It is one of the point of these three drugs. With that, they also disturb the other drugs by doing the drug interactions, by interfering with the cytochrome P450 system. Like carbamazepine, phenytoin, they are inducing the cytochrome P450 system, like increasing its activity. So that's why the efficacy of the other drugs get decreased, like warfarin. So when its efficacy would get decreased, what will happen? Increased chances of the clot formation. And one of the drug, so valproate, it is doing what? It is inhibiting the cytochrome P450 system. Okay, should remember, inducers are these two, carbamazepine, phenytoin, and inhibitors is the valproate. When it inhibited, it means cytochrome P450 system would do will decrease its work. So the efficacy of the other drugs would get increased, such as apixaban. It is one of the antiarrhythmic drug given in the AFib. So increased risk of the bleeding would happen in this condition. Okay. Next is teratogenic. There are some drugs. Actually, these are the three drugs which are doing the drug interaction. Carbamazepine, phenytoin, valproate. They are actually the teratogenic too. Okay, how they are teratogenic? They are actually altering the folate absorption, and folate or folic acid is actually the one which is needed for the neural tube formation. When there will be the decreased folate because of these drugs, what will happen? There will be the neural tube defects. Okay, and most of these children will having the spina bifida. Those children whose mothers taking these drugs in the first few months of the pregnancy. Okay, so these are the side effects. These were the management. Now, withdrawing of the drug. Actually, when you start the drug to the patient, they usually ask the question, the doctor, how long I will take these drugs? So you will in a way that if you are seizure free for more than 2 years or 2 to 3 years, there are much more chances. These are the much more chances that you get seizure free if you are continuing this drug for more than 2 years. And if you are such fortune of among these 80% people, then you can stop the drug. But there are recurrence rate. You have to consider in a way that if you're seizure free for more than 2 years, you can stop the drug. You can stop the drug, but there are recurrence. Or the recurrence rate there are 40 to 50%. Now, what the question is, does every epileptic patient having the same recurrence rate? No, not everyone. Actually, the absence seizure, which is more common in the children, they having a very less chances of the recurrence rate, because these children, when as they grow older in their adulthood, what happens? Most of these children get rid of the epilepsy in their adulthood. Okay, Very few move to the generalized tonic-clonic, but most of them get rid of. So their recurrence rate is much less if they get treatment properly and if they are seizure free for more than 2 years. Now, the next one is the focal seizures, like some partial seizures, some underlying causes here, like structural lesion. In this condition, if a structural lesion is still present, tick means is still present, then high chances of the recurrence. But if structural lesion is being treated, cross means no structural lesion, then there's way less chances for the recurrence. Okay, so the recurrence rate depends on person to person's epilepsy. Okay. Okay, let's talk about something about the counseling, that how we will counsel these patients. We have to counsel these patients, advise them related to the activities, whether at home or whether at their workplace. Okay, at home we will advise them to take the shallow baths. Okay, and use the washroom without locks, especially for those who are having the generalized epilepsy, in which they lose their consciousness. That's why. For swimming, we would advise not to go deeply, because if they get seizure in that condition, it will be dangerous for them. Advise them not to go to the heights, or choose the occupations where they will triggers which can actually cause epilepsy. Triggers are that, say for example, a patient have susceptible for the seizures attack, and some triggers he might have which leads to the seizures attack. Okay, so we counsel them to avoid these triggers. The triggers can be sleep deprivation, can be loud noises, can be exhaustion, which may be emotionally, which can be physically exhaustion. Okay, some drugs withdrawal, like if he is on the benzodiazepines, its drug withdrawal can be dangerous for them, it can become a trigger factor. And flickering of the light, alcohol, so these are the factors which can trigger the seizure attack. So that's the end. Hope you understand that. Bye bye.